We're here now with some of the organising committee of this year's event. Thanks for joining us, guys. We've got Dr. Tim McCulloch.
Good morning.
Dr. Ben Olesnicky.
Morning.
And Dr. Jenny Stevens.
Hi.
Cool, guys. So we'll start with you, Tim. Tim, tell us about the meeting in general this year. What's on the cards?
Well, it's the first anaesthetic conference in this amazing new convention centre in Sydney. It's the second time we've formally combined with the Royal Australian College of Surgeons scientific meeting, so it's very exciting in both of those regards. We've chosen a theme together with the surgeons, and the theme of the meeting is reflecting on what really matters. And what we've discovered is when you sit down and think about what really matters, there's lots of different things that really matter, and we're trying to cover as many of those as possible in this meeting.
And there's a college ceremony going on tonight, is that right?
College ceremony is this evening, so all the excited, newly qualified specialists in both pain and anaesthesia are going to be presenting and graduating. And if people miss that exciting ceremony, then they can watch it streamed live on Facebook, and that'll be available for a few days.
And is there, what's the importance of fellowship and social interactions at this year's event?
Well, it's called the annual scientific meeting, but it's much more than the science. The science is obviously crucial, but it also promotes the profession and progresses the profession in so many different ways, including the fellowship and the social program. Almost every night we've got joint things, and the big gala dinner coming up on Thursday night, which is going to be combined with the surgeons. It's going to be an amazing event. But also aside from that, we've just got lots of elements of things of interest to anaesthetists and the fellowship other than the science, like issues of mental health and the social side of the life as an anaesthetist as well. Yeah.
And there's lots of female presenters as well this year, is that right?
We've been very proactive. Ben's been very keen to make sure we have as good as representation as we can to reflect the diversity of the fellowship. We also want diversity of the people up on the stage, and we've made a really good effort for that as well. Yes.
Cool. Okay, thanks for that. And move down the line now, and we'll come to Ben. So you're part of the scientific program, so talk to me a little bit about that.
Yep, we're really lucky this year that we've got a wealth of international visitors, both from the college and industry supported visitors. So when you look down the program, the only problem you have is deciding which session to go to. There's so many great sessions. I'm very proud of the program we've put together. There's something in it for everyone, and I think everyone will have a great time when they come along.
Who are some of the big speakers you've got this year?
So there's a few too many to mention, but the big speakers the colleges are bringing along is Karen Domino, who's a professor of anaesthesiology from Seattle, Rick Dutton, who's from Dallas and also in the Anaesthesia Quality Institute, and Fiona Kiernan, an anaesthetist from Ireland, who's also getting a PhD in economics and behavioural economics.
Oh yeah, so plenty for everyone to look forward to.
Yeah, definitely.
Awesome. And come down the line now to Jenny. How you going?
Hi, good thanks.
So yesterday we had a refresher course day. What was that all about? Let's start with that one.
So it was about a whole range of things. So we had one of our international speakers, Professor Tor Wager, talking about neuroscience and making it seem rather simple, making a very complicated subject understandable for us. And that was the same with Professor Mark Hutchins as well, converting all of this complicated neuroscience into a simple colour that all of us could understand. And then we went from that, and we had a lot of talks around safe use of drugs as well. So really fascinating stuff from Dr. Marianne Jauncey from the King's Cross Injecting Centre. That was a great talk. And then finished off with the Dean of ANZCA, Professor David Scott, giving an excellent presentation on delirium and practical steps for pain and anaesthesia and how we can prevent it and manage it. So it was a good day all up.
Yeah, and you're also part of the ASM pain program? So
yes.
What's that all about?
Yeah, so that's again combined with the Royal Australian College of Surgeons, and we're doing a whole spread of things. We're doing quite a lot on neuromodulation from both surgical and pain medicine perspectives. We've also got some really good free papers that have been done by members of the faculty and having judging of those during the week. So a whole combination of things. Should be really good.
Yeah, shaping up to be a pretty good week, guys. Yeah. I guess congratulations for bringing it all together and have a good week.
It's
Thanks very
a
much.
great week. Thank you.